Enuresis, commonly known as bedwetting or the involuntary urination in inappropriate places, represents one of the most prevalent childhood conditions that affects millions of children worldwide. This condition, characterized by the repeated voiding of urine into clothing or bed during sleep or waking hours, extends far beyond simple accidents and encompasses a complex interplay of physiological, psychological, and developmental factors that require careful understanding and compassionate management. The medical definition of enuresis encompasses both nocturnal and diurnal forms, with nocturnal enuresis being the more common manifestation where children experience involuntary urination during sleep. Primary enuresis occurs in children who have never achieved consistent dryness for extended periods, while secondary enuresis develops in children who previously maintained bladder control for at least 6 months before experiencing a recurrence of wetting episodes. This distinction proves crucial for healthcare providers in determining appropriate treatment approaches and identifying underlying causes. The prevalence of enuresis demonstrates significant age-related variations, affecting approximately 15% of 5-year-old children, with rates gradually declining as children mature. By age 10, roughly 5% of children continue experiencing bedwetting episodes, while only 1 to 2% of adolescents and adults maintain this condition. These statistics highlight the natural tendency for many children to outgrow enuresis without intervention, though the emotional and social implications during the affected years can be substantial. Understanding the underlying mechanisms of enuresis requires examination of multiple contributing factors. Genetic predisposition plays a significant role, with children having a 75% likelihood of developing enuresis when both parents experience childhood bedwetting, compared to a 15% risk when neither parent had the condition. Neurological development also influences bladder control, as the maturation of neural pathways responsible for recognizing bladder fullness and inhibiting urination occurs at different rates among children. Hormonal factors contribute significantly to enuresis development, particularly the production of antidiuretic hormone, ADH, during nighttime hours. Some children with enuresis produce insufficient amounts of this hormone, resulting in continued urine production during sleep rather than the normal concentration that occurs in unaffected individuals. Additionally, bladder capacity variations and heightened bladder sensitivity can contribute to inappropriate urination episodes, especially when combined with deep sleep patterns that prevent children from awakening when their bladder reaches capacity. Psychological and environmental stressors frequently trigger or exacerbate enuresis episodes, particularly in cases of secondary enuresis, where previously continent children began experiencing renewed wetting. Family disruptions, school transitions, birth of siblings, moving to new homes, or other significant life changes can manifest as regression in toileting behaviors. Emotional stress, anxiety, and trauma can similarly impact bladder control mechanisms, highlighting the importance of considering psychological factors in comprehensive enuresis management. The impact of enuresis extends beyond the physical inconvenience, often creating significant emotional and social challenges for affected children and their families. Children experiencing bedwetting frequently develop feelings of shame, embarrassment, and lowered self-esteem, particularly as they become increasingly aware of their condition's perceived abnormality compared to peers. These emotional consequences can lead to social withdrawal, reluctance to participate in overnight activities, and strained family relationships when parents respond with frustration or punishment rather than understanding and support. Family dynamics play a crucial role in how children cope with enuresis, with supportive, patient approaches generally yielding better outcomes than critical or punitive responses. Parents who maintain realistic expectations, provide emotional reassurance, and implement practical management strategies help create environments where children can develop confidence while working toward achieving consistent bladder control. Conversely, negative reactions, shaming, or excessive pressure can worsen the condition and create additional psychological burdens. Comprehensive evaluation of enuresis involves careful medical assessment to exclude underlying medical conditions that might contribute to inappropriate urination. Urinary tract infections, constipation, diabetes, neurological disorders, and anatomical abnormalities require identification and treatment before addressing primary enuresis. Healthcare providers typically conduct thorough histories, physical examinations, and appropriate diagnostic testing to establish accurate diagnoses and develop individualized treatment plans. Treatment approaches for enuresis encompass various strategies ranging from behavioral interventions to medical management, depending on the specific circumstances and severity of the condition. Behavioral modifications often serve as first-line treatments, including establishing regular toileting schedules, limiting fluid intake before bedtime, and ensuring complete bladder emptying before sleep. Bladder training exercises can help increase capacity and improve awareness of bladder sensations, while positive reinforcement systems encourage progress without creating additional pressure. Alarm systems represent highly effective treatment options for motivated children and families, utilizing moisture sensors that trigger awakening when urination begins. These devices help children develop awareness of bladder sensations and establish appropriate responses to the urge to urinate. Success rates with alarm therapy reach 70% or higher, though treatment typically requires several months of consistent use and family commitment to achieve lasting results. Pharmacological interventions may be considered when behavioral approaches prove insufficient or when rapid improvement is necessary for specific situations. Desmopressin, a synthetic version of antidiuretic hormone, can reduce nighttime urine production and decrease bedwetting episodes. Anticholinergic medications may help children with overactive bladder symptoms, while tricyclic antidepressants occasionally provide benefits through their effects on sleep patterns and bladder function. Alternative and complementary approaches to enuresis management include dietary modifications, such as identifying and eliminating potential bladder irritants, ensuring adequate fiber intake to prevent constipation, and maintaining appropriate hydration throughout the day while limiting evening fluid consumption. Some families explore acupuncture, chiropractic care, or herbal remedies, though scientific evidence supporting these interventions remains limited. The long-term outlook for children with enuresis is generally positive, with a vast majority achieving consistent bladder control as they mature. However, the journey toward resolution requires patience, understanding, and appropriate support from families and healthcare providers. Early intervention and comprehensive management approaches can minimize emotional impact while maximizing the likelihood of successful outcomes. Prevention strategies focus primarily on establishing healthy toileting habits from early childhood, including regular bathroom schedules, proper toileting posture, and complete bladder emptying. Creating supportive environments that normalize discussions about bladder function and provide reassurance during toilet training can help reduce anxiety and promote positive associations with toileting behaviors. In conclusion, enuresis represents a common childhood condition that requires compassionate understanding and comprehensive management approaches. While the involuntary urination in inappropriate places can create significant challenges for children and families, appropriate treatment strategies and supportive environments can effectively address this condition while minimizing emotional impact. Recognition that enuresis is a medical condition rather than a behavioral choice helps families approach treatment with patience and realistic expectations, ultimately supporting children's successful journey toward achieving consistent bladder control and improved quality of life.